sees the ingredients list and he's pondering it, and the server comes up to him and he says, can I make you a pizza? And he says, yes, I would like that. What would you like on your pizza? And the Dalai Lama says, can you make me one with everything? I'm smiling. That's the end of the joke. Can you make me one with everything?
Get it?
Get it?
Everything?
Can you make me one with everything? Can we all be one with everything? Ah, we got it. Excellent. I personally stand for health freedom. I want to make clear that I'm not accusing anyone of not standing for health freedom, or I'm not accusing anyone of not being able to solve the issues that I think are important. But something that baffles my mind, and has baffled my mind through this entire thing for the last couple of years, is that there are 25,000 people a day die of starvation in our world.
You do have to put your mask back on.
I'm sorry, doctor.
It's okay.
25,000 people a day die of starvation. That's 9 million people a year in our world die of starvation. One child every 10 seconds dies of starvation. The number one cause of death in our country is heart disease, followed closely by cancer. I don't understand how we have these mandates, and I think they're crap. I don't believe that Governor Pritzker can mandate us to wear masks or our kids to wear masks when I feel like I know what's best for my children and my grandchildren. I feel like I know how their immune system is. I'm responsible for my health. I'm responsible for my kids' health. I don't see President Trump or President Biden or Governor Pritzker being responsible for my kids and my grandkids. There are no mandates for lack of food that we have plenty of to feed our entire world. There are no mandates of what we feed our kids in these schools and what are the ingredients on our shelves of the American diet. 2/3 of adults are overweight and obese. 20% of kids are overweight. That's where the problem is. The problem, I don't see a problem with COVID or the flu. And so that's where my problem is. And I stand for health freedom. I believe that we should be able, as parents, to speak for our kids, stand up for our kids. And that is as simple as it is for me. Thank you.
Thank you. Next.
Dr. Robert Bartok.
5 minutes, right? I have a lot of information, so I'm from back east. I'm going to talk quickly. I apologize already, okay? So my name is Dr. Robert Bartosh. I've been practicing physician here for 40 years in Danville, Illinois. My first doctorate was in chiropractic. I have 22 postgraduate certifications, some of which are in virology, immunology, endocrinology, cardiology, neurology, primarily brain disorders, damage and malfunctions, and also in genetics and epigenetics. I've been asked to come here for some of the parents that are invested, their children, and I apologize, please, to you, because I'll be looking at many of my notes to make certain that I don't misstate some of this information. So I do apologize beforehand. I want you to understand that any intervention that's taken, including the mass usage, is going to, like with all interventions, you have the pros and the cons. And when you make a decision, for every action, there's always an equal and opposite reaction. And this decision that you make currently, or that is being made, is planting a seed with which is going to harvest for many, many years down the road. and it's going to be affecting children primarily. Not so much you and I, but the children. And as far as any kind of benefits to it, and I will not share with you my opinions or beliefs or philosophies, I will share with you what the CDC says. And the CDC has been positioned as the authoritarian institution during all of this time. I liken the CDC to a buffet, if you will, on information. And the individual that goes to the CDC can pick whatever information out of it that so suits him or her at that time, leaving whatever it is that is displeasing to them, maybe for a later time. And like a buffet, the CDC has exchanged information. If we go back not too far, when we first got into this conundrum, masks were mandated. And then we learned that one mask was not enough. You needed to double the mask or you needed to triple the mask. Then after that, we needed the vaccine. After the vaccine was introduced, only those that were vaccinated could be without the mask. And then later on, we found out that even if you weren't vaccinated, you could be without the mask. Now we're in a place where even if you are vaccinated, you need the mask once again. That doesn't speak to me as factual. It speaks to me as somewhat confusing at best, because there is a situation in this scenario that's not variable, and that is the COVID. It's not variable. But apparently the decisions of the pundits, of the lawmakers, is what is variable. One day they're on, one day they're off, and you know the scenario. So, the masks, I want to state to you, are harming the children. As a matter of fact, the widespread masking is affecting the children mentally, physically, as well as biologically. And it's largely assumed, or was assumed, that the face masks were safe to children to wear for long periods, such as during school, but no risk assessment had been carried out up to this point. However, one has been done now. Research has shown us now, and you can certainly fact check all of this. The data was on 25,930 children, 25,930 children, from which there was reported 24 different health issues associated with wearing the masks only, that fell into the categories of physical, psychological, and behavioral issues. The CDC reported, and these recorded symptoms were that 60% of the 25,930 children started to experience irritability. 53% of those same 25,000 plus children started to develop headaches. 50% started to develop an inability to concentrate. 49% of the 25,000 became unhappy or started to become depressed. There was 44% of them developed a reluctance to go to school, including kindergarten. And I'm sure you remember when you were younger, the excitement that was upon kindergarten kids. They couldn't wait to go to school and eat lunch and meet their friends and everything else. So even at the kindergarten age, these young children had a reluctance to go to school. 42% malaise, 38% impaired learning and drowsiness or fatigued, and 37%. Now, it's commendable that the children are going back to school, because that's going to be the best environment for them to be in, especially teacher and student relationship. Research shows us that that's where they gain the most. However, in this research, these children were in school, and despite them being with a teacher, they showed a 40 or 38% decrease or an evidence of impaired learning.
You're at F5, so if you can wrap it up. Okay.
I will tell you what.
Can't do that, ma'am.
No,
I'm sorry.
I can't do this justice, and I do apologize. If you would contact my office or the website, I will be more than happy to supply you with the information, factual, empirical information, research from the CDC that unfortunately hasn't been forthcoming to the public. So, thank you.
You can send that information to us if you like.
I shall.
Okay.
And please, if you would give me the contact information before.
It's on the website. Yeah, it's easy. We're on the district website, on District 118 website, and all of our email is there. So you can do it at one time. So
More than
what?
happy to. Thank you for the opportunity.
I'm always interested.
Great.
Thank you.
Mr. Paul Fuller.
No comment.
Okay. Ms. Caitlin Mormon.
And we're trying, on the time, we are trying to be a little flexible here. We're not, we let you go over a little. And we'd like to give you a heads up maybe at, 4:45 or whatever. But, we're just trying to adhere. So, thank you.
Hi, I'm Caitlin, and I'm a registered nurse and mother. I have been working as a nurse in the midst of this pandemic since it began. Not once has our hospital been overwhelmed with COVID-19 patients. In fact, as a nurse in the middle of a pandemic, when I thought my job was secure, I was furloughed. Our census was down lower than it ever had been. Nurses and healthcare staff were being furloughed, called off, sent home early every single day. Now that our census has picked back up, it's definitely not COVID-19 that's overwhelming us. There is zero evidence that masking a healthy individual, especially a child, is beneficial to anyone. Masking a school-age child is pure theater at this point. It is said that we are masking because of the rise in cases of COVID, but are we looking at each case individually? Do you know what defines a case? Do you know that as a nurse, I have to swab every single one of my patients who gets admitted to the hospital for COVID, whether or not they came there for COVID symptoms? We know that the tests give a high rate of false positives, so if my patient who came in with a broken arm gets admitted and I swab them and they come back positive, though asymptomatic and probably a false positive, that's a case. My question for you all is, what's the end goal? If it's to protect the vulnerable, will we be masking our children for the rest of our lives? Vulnerable, immunocompromised people have been protecting themselves for years. As healthcare professionals, we know that people can be carriers of many illnesses and diseases, including things like meningitis, and this is not likely the last novel virus that we will encounter in our lifetimes. These things don't just disappear, which is why the vulnerable are taught to protect themselves as best as possible. We have been social distancing and masked for over a year now, so what's the end goal? As a nurse before the pandemic, when I had a patient who was on droplet or airborne precautions, guess who protected themselves? It was me. I wore a mask and my PPE into my patient's room because I'm responsible for my own health. As a parent, I'm responsible for my children's health. I don't put the responsibility onto the teachers and staff of the school district. My children eat good, nourishing food. They take their vitamins. They get enough playtime and sunshine, and they get enough sleep every single day because that's my job as a parent, to control the controllables and set them up for the best possible health so that their bodies are equipped. By mandating that our children wear masks for 6+ hours a day, no exceptions, you are discriminating against those other serious health concerns that put wearing a mask and restricting a child's breathing at extreme risk, not to mention the social and emotional consequences of children who are in crucial developmental ages. Have we ever stopped to consider how this will affect them for years to come? If only the same amount of energy and money that was spent mandating and regulating mask wearing for our children this past year and cleaning with toxic cleaners like Lysol and Clorox was put into making long-term changes such as sinks in every classroom so kids could wash their hands more often, or revising the breakfast and lunch meals to be more healthy, or air purifiers in each room, perhaps better ventilation systems, our children could have been set up for positive long-term health benefits. Overall, COVID-19 has not proven to be a threat to school-age children. There are studies to back this up. I hope that the right thing is done and it's left up to the parents of the children who are attending and paying for their children to attend your schools to decide what's best for their child's health. God has entrusted me to care for my children, and the decision whether to mask my child or not is up to me. No matter the outcome, our children who've not worn a mask this entire time will not start now. Thank you.
Ms. Kristen Jackson.
I won't need 5 minutes. I like to do things short and sweet. So first I just want to say hello board and thank you for giving me the opportunity to speak today. I'm Kirsten Jackson. I'm a mother to 2 in the Danville District and a Danville High School graduate myself. I've come here today to keep it short and sweet, like I said. I am against mandates of any kind, that including mandates of masking our children. If you feel comfortable masking your child, I think that you should do it. If you don't want to mask your child, I don't think you should be forced to do it. The choice should be up to the child's parents. Thank you.
Ms. Savannah English.
Hello, board.
and Dr. Betty's. My name's Savannah English, and I'm actually very uncomfortable up here, but I wanted my voice to be heard. And I just want to let you guys know that I also strongly believe that masking should be up to parents. It should be parents' choice. And I also think that rules need to be more clear. I actually had a situation arise Monday. My daughter is in marching band in band camp at Danville High School. And, well, she woke up with a sore throat. So I did what I thought I should do, took her to Carl Clinic, which Carl Clinic gave her a swab of the throat to check for strep. It came back negative. I contacted her teacher, Mr. Kraft, and asked if I should let her go ahead and come in because she was going to be late, and I explained what happened. I could have just not said anything, but I wanted to be honest. He said to go ahead and bring her Tuesday, that Tuesday would be okay to bring her. So she stayed home Monday. That was about 8:30 in the morning. At 2 o'clock in the afternoon, I got a phone call back stating that my daughter needed to get a COVID test, which I felt like she was already at the walk-in clinic. If the walk-in clinic thought she needed a COVID test, they probably would have gave her one, but I wanted my daughter not to miss out on marching band, so she went to OSF Ergo. She was there for an hour and a half, and it came back that her test was negative. So I contacted Mr. Kraft again, which in no way am I upset with him. Want to add that. He's just doing his job and doing what he was told to do up the line. So basically, he had already, I forgot to add this part, before I got her a COVID test, he asked me if she was vaccinated, which pretty sure, not to be rude, it's kind of not his business whether my daughter was vaccinated or not. But I told him no, she's not vaccinated. And that's when he had said, she needs to go get a COVID test. So I took her, she was negative, and he asked me to send him over the information, like the screenshot of the doctor's note stating that she's negative. I did send him the negative result. Then I was told that she might have to go ahead and stay home for 10 days because she's not vaccinated, which is not accurate at all. But none of the higher up people, if you call Danville High School, they don't know the regulations. So I posted on a group in Facebook. It's kind of parents who think that masking should be optional. And one of the teachers, who actually is a school nurse, told me to call her the next day at Northeast. So I did. And she said that no one should have ever told me that my daughter potentially should have had to miss 10 days because she was unvaccinated. So I feel like, honestly, I get that things change from day to day, but I also feel like I shouldn't have had to call 5 or 6 different people to make sure my daughter was at band camp. Because 10 days means she might as well not be in band, because band camp's 9 hours a day for the next 10 days. Mm-hmm. And then she wouldn't have even known. Now, if she really did have COVID, obviously, I wouldn't have sent her. But I'm saying she didn't, and I felt like because she wasn't vaccinated that she had a different set of rules, so to speak. I don't know if I'm making any sense up here, but I do definitely think that it should be parents' choice whether to mask or unmask your child, vaccinate or unvaccinate your child. And I also feel like everyone, if there's a rule, everyone should be following the same exact rule as far as what's going on and who to tell what. I shouldn't have to keep asking different. That's all. Thank you, guys.
All done. Anybody else?
Okay, thank you for your comment. Appreciate that. Yes, whatever you like.
So let's first do the introduction of administrators, and then I will go through the progression of documents.
Good evening, Board and Dr. Geddes, and everyone here in attendance. My name is Kimberly Pabst, and I'm the Director of Human Resources here for District 118. And tonight I have very exciting news. We are bringing forward 3 new assistant principals to our district. So I'd like to start with Mr. Eric Nethercott, if you'd like to come forward. Mr. Nethercott is a graduate of Loyola University in Chicago, Xavier University in Louisiana, and also from the University of Illinois here in Champaign, I should say. He brings with him a wide range of teaching experience, from English and reading and social studies, even a college counselor, to working at our own Northridge Middle School as a teacher, Saudi Arabia, South Korea, and even New Orleans. So we are glad you chose Danville to make your home. He is definitely what you would consider a lifelong learner. He puts students first, and a previous administrator of his has said that he makes every effort to make all students feel like an important member of their classroom. It is truly a passion of his to find the data from our students, dig deep, and figure out what to do next to help our students. So at this time, I'd like to introduce Mr. Eric Nethercott, the assistant principal at Mark Dimon Elementary School.
Dr. Geddes, members of the board, superintendents, friends and family, thank you so much. To say that I am both deeply honored and humbled would be, it would be a gross understatement. And I recognize that if I am to stand tall in this position, like the saying goes, it's because I stand on the shoulders of giants. So I'd like to extend a special shout out to the D118 family for allowing me to have this honor. And I promise I will do my best not to let you down. Thank you.
Ms. Amber Davis, if you'd come forward. Ms. Davis is a graduate of Danville Area Community College and Eastern Illinois University with both her teaching and administrative degree. She student taught at East Park, Mark Dimon used to be East Park, and then got right into her teaching career as a teacher at Mark Dimon Elementary School in 14-15. She taught there for a few years and decided to go to Northridge Middle School, where she has been one of the deans for the past 3 years? 4 years. Amber is definitely a leader. She is proactive in serving our students of the district and of the community. She works to ensure that all students have the opportunities given to them. We definitely look forward to seeing what Amber brings to Northridge Middle School. She has a very contagious, positive attitude, a great smile, and she's definitely here to serve our students. And congratulations, Amber. We look forward to seeing you at Northridge.
Good evening. Thank you for everyone. Thank you to everyone for coming out this evening. I appreciate your time and this opportunity. Thank you to the board. Thank you to Dr. Geddes, Dr. Jacoby, Mr. Hart. I am a Danville native, although I grew up in Chicago. I've returned. This is my home. I love District 118. My son attends these schools, and I'm going to make you all proud. I love our community. I love District 118. I love our students. And thank you very much, and glory be to God.
I don't know who's more excited, us bringing in these administrators or the administrators taking the positions, because we sure got some great ones coming in. Next, we have Scotland Vogel. Scott, if you'll come up. Scott is returning to his home of Danville High School. He's a graduate of DACC and Eastern Illinois University with multiple degrees from teaching to administration to superintendent's licensure. He's taught at Paxton Buckley Loda for quite a few years. He was an AD and also a dean in Hoopston. He's been back in Danville District 118 since 2015 as a dean, as a social science teacher, as an AP. He definitely is a team player. He's a giver. And another administrator has said on him that he models patience and understanding for students. He serves on multiple committees and leadership teams, as our other new APs have as well. He very much demonstrates a passion for serving our students and his coworkers. Mr. Scott, congratulations and welcome back to DHS.
I just want to say, Dr. Geddes, thank you. Board of Education, thank you. Mr. Hart, Dr. Jacoby, thank you. I look forward to working hard and serving the District 118 community, and I can't wait to get started. So, thank you.
Just one last thing, not to embarrass any of these three, but I do want to just tell everyone on our board and superintendents that when calling each and every one of them, their excitement and tears from all of them, I think, and are you serious? Me? Like those offers, it was an honor to get to call them, and I'm very proud to have them serving our students. So, thank you.
We're certainly excited to have them. And we appreciate you already. We're going to pre-appreciate you and look forward to the excitement of the next couple of years as we go forth, and hope we all have success together. So welcome aboard, welcome back, whatever your instance is, and thank you very much for coming. Or how about this? Thank you for picking District 118. Okay, we certainly, you have no idea how much we appreciate it, especially in today's climate. So thank you very much. I'm sure our board members will agree with that, but I won't speak for them. Next.
All right, return to school plan. Mr. Henderson, I know I said 5 minutes, but I just think it's important that I'm gonna take a 3-minute diversion because I really hope all of our parents were able to read the information I put on the 29th because it explains the confusion and how we had 3 sets of information in one day, 3 days straight. So I'm just going to take 3 minutes, if you may, and just review that. On Friday, July 9th, first we were told that the Illinois Department of Health was adopting the CDC COVID prevention school guidance. That guidance told us we're now fully aligned with the guidance for vaccinated people, which allows activities to resume for fully vaccinated people without wearing a mask, except where required by federal, state, and local rules. Because many of the schools serve children under 12 who are not eligible for vaccination at this time, therefore, they wanted us to implement a layering approach of prevention strategies to protect students who are not fully vaccinated. That was Friday. On Monday, July 26th, in the morning, they said, this guidance takes effect immediately for all Illinois schools, public and non-public. We're now aligning the masking requirements for schools with guidance for individuals who are vaccinated. Later that afternoon, they then said masks should be worn indoors by all individuals who are not fully vaccinated. They wanted consistent and correct mask use by people who are not fully vaccinated, especially in indoor areas and crowded settings where we could not maintain 6 feet. They also gave us a warning later that afternoon that said, in addition to the health and safety reasons for following the CDC's guidance, school districts that decide not to follow the guidance should consult with your attorneys and the insurers regarding risk assumption and liability coverage. The next day, they said, CDC recommends universal indoor masking for all teachers, staff, students, and visitors to school regarding a vaccination status. See how it changed? So you got 3 different answers because we had 3 different sets of directions within 2 days. Children who return full-time in the fall put the proper prevention strategies in place. Wear a mask in public indoor settings if they are in an area of substantial or high transmission. And then Melissa Rome sent out a set of information to say we were in substantial level of occurrence. On Wednesday, in the morning, the Illinois Department of Public Health recommended the following based on the interim public health recommendations for fully vaccinated people. Fully vaccinated people should wear a mask in public indoor settings in areas of substantial or high transmission. They added a recommendation for fully vaccinated people who have been near a known exposure or with someone who was suspected or had a confirmed case of COVID-19 to be tested. wear a mask, and stay home for 14 days until they receive a negative test result. Later that afternoon, they added, we now recommend universal masking for all students, teachers, staff, and visitors regardless of status, and maybe you can do 10 days. That's where we were for a while. Today, Governor Pritzker at 3 o'clock announced effective immediately, all P-12 schools are under a universal mask mandate. His information said, where did I lose my? Here we go. Governor J.B. Pritzker issues a mask mandate for schools effective immediately and vaccine requirement for some state workers. It came as the fall semester approaches and school boards across the state grapple with the decision of whether to require masks in light of the CDC's recommendation and prevention strategies last week that said everyone wear the mask. Because he found out, and I quote, that far too many school districts have chosen to follow the federal CDC guidelines for keeping students safe, he is issuing a new requirement, which applies to all public and private schools and daycare centers. That is effective immediately as of 3 o'clock this afternoon. Let me be proactive and tell you, when it comes to sports, we have 3 different directives already. IHSA said the mask directive for indoor athletics applies to student athletes, coaches, officials, game personnel, and fans. It applies to all fall sport practices, contests. Swimmers do not have to wear the mask while competing, but must adhere at all other times. The directive also applies to any winter or spring IHSA sports that may be conducting open gyms, general conditioning, or weightlifting. IASA, which directs all of the superintendents in the state, I'll skip the rest of it, get to the meat of it, says in line with CDC guidance, masks are not required for all in line with CDC guidance, masks are not required for all outdoor activities where the transmission rates are lower. Melissa Rome issued the statement that we have now moved to the high transmission category. Our attorney gave us a thing 5 minutes ago. There is no mask requirement for outdoor athletic activities, though additional protocol for student athletes were recommended. 3 different directives by all the people who govern us. So I can't tell you what we're supposed to do right now as it relates to outdoor activities. So it's not that we are trying to confuse you or put out misinformation or look indecisive. These are the directives that we are given and told to follow, and they can change 3 times in the same day. And we set out 3 different messages, which can be confusing. So we ask you to bear with us. We're just trying to jump through the hoops that we are given. With that, I have for you this evening the return to school plan for Danville District 118. In it, it outlines our regular school hours. There is a slight change to the student hours for elementary. They will begin at 7:45 and continue on to 2:15 p.m. The staff hours are outlined. I won't mention that for you, but there will need to be a change. In the next section, under safety procedures for masks, in the document on the website, it does say in outdoors that masks should be used for outdoors for individuals over 2 regardless of vaccination status. I don't know really right now what I'm supposed to put there, but I'll try to figure it out. Okay? Otherwise, per the guidance, all students, staff, and visitors must wear masks regardless of vaccination status. I can tell you from serving on the committees with IASA, when we were initially, because remember I talked about taking a multi-tier tiered, layered approach, and as we meet certain benchmarks, we can begin to pull back the mitigations. They were clear to let me know that whenever I cannot prove that a mask protocol was in place, I will be forced to implement quarantining guidelines, which will be 10 days, 14 days, 12 days, I don't know, because that keeps changing too. So the only way right now to keep kids in person full day is to have a masking protocol in place. When we pull back, and I'm saying when we pull that mitigation back, we will be subject to that same, you close for 14 days, you're home for 10 days, you're home. Remember the back and forth, we're open, we're closed, we're open, we're closed. That will come into place when we pull the masks back. I want to make sure that everyone knows that up front. Okay? Home hospital instruction. Yes, right now, the only way to have a remote program until we get a policy, and I just didn't have time to get a policy. Remember the whole thing at the end of the year? I thought Right now, you must be on homebound in order to attend in a modified version. And you need a medical statement in order to receive homebound instruction. Vaccinations, as we were required to say, that we strongly encourage all students, staff, and families to get vaccinated. Are we requiring it? No. That is not a mandate that we have been given at this time. We've implemented the ventilation systems. Thank you, Skip and Seth. We are no longer in charge of the symptom screening. That is the parent responsibility, as we have fought for. Again, in the document, right now it says 14 days. We're supposed to change it back to 10 days, but then we have 3 different documents that have 10, 12, and 14 days, and right now don't know which one I'm supposed to pick. We will make the changes accordingly. Extracurricular, right now at this time, all indoor activities require a mask. I think that's the summary of it. Are there any questions?
Let's go board questions first, okay? Any board members have questions first?
I do. Do we have the COVID protocol for staff quarantining? Specifically, are we going to grant quarantine days as we did last year for staff? There's been no mention of that, and when a person is out because of a positive COVID test, what are our plans for that? That's question 1. Question 2, along the same line, you said a student needs a note, a hospital note, or to have a documentation of medical need for basically what we consider virtual education. What happens to the student who's quarantining for 10 to 14 days? What are our obligations for their education during that time?
Okay, first one, staff protocol. We have to bargain that with the DEA, and we have not sat down to do that as the guidance just came out today. I can tell you, unlike last year, there are no COVID days in place. There's no federal documentation or guidance to give us the ability to grant COVID days, which means if you were quarantined because of COVID, the federal government would reimburse that whole thing. That does not exist right now. So we do need to sit down with the DEA and bargain what the Board of Education is going to do with that. We have not done that.
So the scenario, a staff member is quarantining because they were indirectly or directly exposed through no fault of their own, and they have to take 10 to 14 days of their own sick time, personal time, etc., through no fault of their own. And that is going to be an issue that the DEA will discuss with you?
Because it's a change in working conditions.
Okay.
That has to be bargained and sat down, and we have to come to a MOA, a memorandum of agreement with the DEA.
And when's that going to happen, since we're already experiencing such things?
Well, we have that scheduled. Jerice, when are you on the agenda? I'm sorry, I don't remember when you're on the agenda to meet with us. I know you met with Ms. Rankin and you're meeting with Kim Pabst.
Yes, I got a text message today, and unfortunately, I was in trainings and such, And so Ms. Paps and I will be meeting to go over a list of things that she sent me, and the MOA for this is on that agenda.
Thank you. I understand it's all new and that it keeps changing. It's just, it seems like we need that protocol in place. And to the students for their educational needs while they're quarantining.
So right now, Mrs. Button has trained the staff that we still have the Google Classroom program in place, and we are training the staff to use that as a protocol for our students. I can tell you what I foresee as a problem when we are quarantining an entire building, 14 days. At one time, we were able to say, okay, if you can work from home and we can do it, we can do remote, we had all that in place. We are going to need to do something like that if what they predict for our fall manifests itself. Because I can see, I know we had a scare at one of our buildings. We're gonna need to say, what do we do when we shut down a whole building? So all those things need to come back to the table. Questions?
Any other board questions?
I have a question. In that same section on quarantining, it was on page 4 and following up on page 5 of your return to school proposal. It appears to be that we are looking at treating vaccinated staff and non-vaccinated staff differently. And I'm concerned about that. One of the statements, while Danville District 118 does not require proof of vaccination, proof will be required for staff or students to avoid being quarantined. And there's a difference in fully vaccinated and non-fully vaccinated staff and whether there are going to be quarantining requirements. I'm concerned about that, treating different staff members differently because of vaccination status. I think we are getting into potential vaccine discrimination, and I want to avoid that. Also, the CDC came out today with information, 28.4% of the Black community, only 28.4% of the Black community have received the COVID vaccine. So I'm worried that we're potentially, if we don't adjust this, that we may get into some sort of segregation or discrimination that doesn't just deal with vaccines, but inadvertently, even if we're unintentionally, racial discrimination. And we really need to guard against that because, as we all know, that you don't have to intend it to be racially discriminatory if that's the outcome. So I'm concerned about that, and I guess my question is, can we pull that section if we're going to be voting on this entire piece? Or do we have a fix in place for that? Or is that something that the DEA will be discussing? Will that be bargained?
Well, unfortunately, the CDC guidelines treats differently vaccinated and unvaccinated people. So that's not anything I'm in control of. And I really don't want to feel like I'm defending the CDC's guidelines. I didn't make them. I'm simply sharing them with you. So I don't want to get into that. I didn't make these. I'm simply reading them to you. And I don't have the ability to alter these. Now, if the board decides to do something outside of the CDC guidelines, certainly you have the ability to tell me to do so. But these aren't anything that I can massage or change on my own, and they're not mine. So I don't really know how to answer your question because these aren't mine. And certainly the CDC does treat currently, as of Wednesday, vaccinated and unvaccinated people differently.
Chris?
So my question, I just don't, I want somebody to explain to me how this mandate is a law. And like what Dr. Geddes just said, she's just parroting what the CDC says. The CDC doesn't make our laws. And I'm kind of lost that when this executive order came out earlier in the year, that's not a law by the governor. Do we know for sure that a mandate is a law? I was looking that up today, and I do feel like it's more of a law than an executive order, but I don't have an answer. I feel like we're all family, so I'm just asking as a family member,
Good
sitting
question,
around the
Chris.
kitchen table together,
You want this?
do we have
Yeah.
to follow
Take care.
the CDC recommendation? It's not a law. Do we have to follow everything the governor says? Because I have not seen it go through any legislation. And I have a very big problem having a dictator in Springfield telling us what to do without being voted on by anybody.
There's where
It
you
doesn't
should be
make
talking.
sense to me.
That's
Well,
my question.
What has happened, Mr. Herron, is that Governor Pritzker has authority to issue an executive order because he issued on July 23rd his 19th disaster proclamation. So a disaster proclamation, the first one was issued in March of 2020. He has 30 days that he has executive power. And so what he's done is at the end of that 30 days, he's issued a new disaster proclamation. He has done that 19 times now to remain in continuous power. So that is why he will have, when this one expires, which should be August 23rd, he will have wielded emergency powers for 529 consecutive days. So typically, emergency powers are for something where it needs to move so quickly that we can't get it through legislation. It can't be, we can't deal with that. But 529 days is, I think, I would agree with you. I think that is leaning toward that dictatorial thing, which I don't think is what we were thinking of. It has gone through the courts. There have been 19 cases. They have sided with the governor. There is one case that's available. The legislature can change that because there's nothing that has been said about that whether or not the governor can continue to, for himself, continue to grant himself these powers. Then the legislature can change it, but they have declined to do that. So for people who are frustrated by 19 consecutive orders of declarations of emergency power where one person is making decisions that have the effect of law, he signed 80 executive orders during that time frame. 80 that have had the effect of law. So you need to be, anyone who's concerned about that needs to be talking to their state representatives. That is where the legislature, the state legislature, can make some adjustments to whether or not our state executive, the governor, can continue to wield that type of power. Because I do not think personally that it was intended to be a continual use of power by one person. So I'm sorry, Dr.
No,
Gittes,
you
I know
did
you were
good.
probably getting ready to say that, but I did my research this
Yeah,
afternoon.
I know you did. I want to thank you for it is a family. We're all sitting around the table trying to understand and digest, even if we don't agree. I'm fine with it. But let us speak respectfully. So I do appreciate it. And yes, he was challenged in his speech, and I wrote his quote. We have the legal authority to enforce this. I said, okay. Because it asked, I don't know who asked me the question, does he have the ability to enforce it? And he was very clear that yes. And then he made 2 other threats to school districts for failure to do so. But go ahead and ask your question.
And so, to follow up on what I'm asking, that is the perfect answer, and I appreciate it so much from you, Dr. Geddes and Ms. Schrader, that is the perfect answer. Thank you for letting everybody hear that. I never could have said that so eloquently as you did, but that's exactly what's going on, and I do not support that personally.
The other thing to be aware of is, as Dr. Gittes said, we're following the CDC here, but the CDC's wording was should and recommend. All over, should and recommend, which gave many people the thought that there's an option. And however, the governor, and I haven't read his executive order. All there is news reports about it right now. But the governor, as I understand it, that's going to come out with must. That's a new level of requirement. And it goes beyond what the CDC says. Does that make sense?
Yes.
So the governor's elected, but the CDC are there, it's a bureaucratic thing. And so we are responsible as an electorate, as citizens, to elect people who will stand up if you don't want this to happen. Elect people who will stand up and say no. Elect your state legislature who will say no if this is a concern for you. So I would encourage you to do that.
I did want to speak to what seems like a discriminatory practice of asking, are you vaccinated? Well, if you're vaccinated, I can treat you one way, and if you're not, let me just read this. CDC guidance provides that people who are fully vaccinated and do not have COVID-19 symptoms do not need to quarantine or get tested after an exposure. Then it says fully vaccinated people who were in close contact with someone who has COVID but do not have symptoms do not need to be quarantined or tested. So then it puts us in the position of asking you, well, are you quarantined? Are you vaccinated? Okay, then I can do either the 10, 12, or 14 days, whatever it is they actually decide. So when you feel like, well, that's really not your business, yeah, we don't really want to ask you. But we're forced, in order to follow the matrix of whether we can let you back in, that's why we're asking those questions.
Otherwise, we have to make the default and assume you're not vaccinated because it's a public health issue at the time. So we have to default to probably the most strict. So that's why, again, we're not into vaccination cards, at least I don't think so yet. Yeah, that's not the intent, is ever to do that. At least that's not our intent. I see a hand up in the back.
Sorry. Do we have a guideline in place yet for enforcing the mask policy? I've just heard parents that have said no. And I don't know if have we thought about how we are supposed to respond to that?
I promise you, since I just got it at 3 o'clock.
I just
I
putting that out there for you, I guess.
Yeah.
Because the DEA, I can just tell you up front, Ms. Hightower has said, we don't want to be in the position of having to police that.
Oh, I don't mean for staff. I mean for students.
No, well, the staff will be in the position of saying, mask up, mask down, mask up. You come onto the dean's office, come onto the detention center, you don't have a mask. See,
Right, but then what do you do if you have a student who says no?
that's what I'm saying, and she has asked, we don't want to be in the policing business, so that is a conversation that we'll have to have at the bargaining table. I was just letting you know that up front, DEA has said, we don't want to be the mask police.
So then in other words, you don't have anything in place then until you talk with these other people, the DEA, is that what you're saying?
Well, since I just got it at 3 o'clock,
But
I don't.
I'm asking the question regardless of whenever you get it. I mean, it's just hard for me to imagine that everybody is just now coming to the reality that this was gonna happen. I mean, we're down to the wire of these kids going back to school. These parents need to have an opportunity to decide whether they wanna come back to the school district or not.
Okay.
There's homeschooling, there's private schooling.
Private schools have the same mandate.
It's absurd
Yeah,
that there's
that's a
no-
private school
have the
mandate
same
also.
mandate.
What?
Private
It's a
schools have
private
the
school
same mandate.
also.
Homeschooling doesn't.
That is an
You're
option.
right. You're right.
You know, I mean,
Mhm.
you know, parents can choose
There you go.
to do
There you go.
that. I mean, you have no guidelines at this point, and we're getting down to the wire to these kids having.
Well, we're gonna have
We just gave
guidelines.
them to you.
We know, we have guidelines, ma'am. We will have guidelines. There are some of the technicalities that need to still be worked out. There will be masks.
There
Am
will
I
be
not
masks.
mistaken? There
There
are
will
going
be
to be
masks.
masks.
And the guidelines have been on the draft of the guidelines have been on the website since Monday.
It's just that every
Yes.
question at this moment cannot be answered about every technicality of how this works with this or whatever, because we've just been issued information at 3 o'clock that we just can't have a question and answer for every question. We will try to work everything out, but your roadmap is, are you gonna have masks or you're not gonna have masks? You're gonna have masks. And are we gonna work it out? The largest question to me, if I was a parent, is what's the outdoor situation look like? Because that's the one that had the highest conjecture in it. So some say you're okay if you're vaccinated outdoors or whatever. I mean, these are the things that need to be worked out. But we pretty well know what the classroom is going to look like, am I not?
With masks.
Yes. So, I mean, there is a plan. For as much of the plan that we could give you right now, I think that's a pretty good start for it. And then as we draft and get everything taken care of and there's a lot of I's to dot and T's to cross to get there. But again, from 3 o'clock till now, that's what we have to work with.
And the question of monitoring that you brought up, ma'am, part of the reason that we don't have that answer, the specific answer, is it represents a change in working conditions for our teachers. And anytime there's a change in working conditions, we have to work with the DEA to come up with an agreement. So we can't, as a board and as administration, we can't just change the working conditions of the teachers ever without working with the DEA to do that. So it's not like we were caught with our heads in the sand about this. You don't really negotiate something like that ahead of time, and that maybe that helps to explain kind of the overall why it is that way.
Ms. Savannah had a question.
And we do realize the climate has changed in the last 10 days. I mean, this is a different, if I was a parent out there and, I won't even go there. But we go through these arguments, trust me, we go through these discussions. I go through these discussions with my wife at home and all the people at work and wherever we go. And it is a changing, my opinion is changing all the time. Okay, and I'll tell you guys, I would love to see no mask. I would love to see no mask. I would love to give you that. People who go, let us make the choice. I would love to do that. Okay, but Pritzker made the choice pretty easy for me today. And also, I spoke with our attorney about what was a prudent way to approach this, board members. And our attorney said what you all thought. It said, you're out on your own. If you don't do this, you give up the liability as a board member, you are exposed and for personal liability for this. And they said, we highly recommend that you don't do that. That's legal. I mean, that's what the legal says. So, as you said before, when Shannon made the great presentation, because as I said, that was very good. I said, as Governor Pritzker said in an article a couple days ago, he said, he actually put this all on him when he said, look, it's not the school boards. When you're going to the school boards, he said they could only do so much. He said it's the governor's office. He said it's on me. He said it was on him. He said this is his emergency power, and we can go against that. But then in this situation with the Delta variant and the numbers spiking up, is it a prudent thing to do? That makes it a very tough situation, at least on my part. I saw a hand up in the back, or
Savannah.
My question is, I understand right now you said it's mandated, but when it was recommended, my child still had to go to school and still had to wear a mask, even if it was only recommended. So, and I'm not like, there are some parents that definitely would have,
We can't hear her.
sorry.
Yeah, can we just have discussion up here? Thank you.
There are some parents that would tell their child, if they tell you have to wear a mask, tell them no. I'm not that parent. My son is a 6th grader at Northeast, and he is on the autism spectrum. And if I were to tell him that he can tell his teacher no, well, then he's going to think he can always do that. He'll think he can tell anyone of authority no, and that's not a good parenting choice for me. However, I'm just wanting to, I guess I'm all over the place, sorry. I'm just wanting to find out, when it was recommended, why did they still not, I guess, have that choice?
You want to answer?
I remember what you were saying, what you said. You said we were going to start with what we had in place before. And then this isn't the guidance we have right now. It's the guidance we had, back when Northeast started. And then as things improved, we were going to remove things layer by layer, because the expectation was at that time that things were going to improve. So that's why we started with the former things in place with the intention, with the thought that things would improve and we would be able to remove that hopefully quickly. Now things changed when the CDC changed and when things just changed. But I hope that explains why, even though the CDC said recommended, that is what I remember Dr. Geddes saying was the foundation for her decision and our decision to, as a board, to start with the former mitigations in place.
Gotcha. I just know all the other county schools, I guess, all were optional, and I actually have someone I know that works for another county school, and they received an email today that still asked if they wanted to fight for it, even though Governor Pritzker already said this, their school district asked if they still wanted to, you know, they took a vote from all of the staff and teachers to see. So I was just wanting to find out, like, why them and not us, I guess.
Well, that's another great, I keep jumping in here, but when Dr. Ashe was talking about liability and tort liability, and it was no small threat, I'll call it a threat, the little highlighted section, if you look at the information that was sent by the CDC, kind of, if we choose not to follow the mandates or the recommendations, if we choose not to follow that, it removes our tort liability. What that means is if there's a sick person, if a child gets sick, if an adult gets sick, if the worst happens, if tragedy happens, and districts get sued, right? Well, we have insurance that covers suits, right? But in this case, because we didn't follow the recommendations, well, then they can sue the district and the insurance doesn't cover it. And also, they can sue individual board members. So, and we don't have insurance for it. Does that make sense? Like I could end up losing, am I right? Is that exact? I think that's.
It's called losing your shield of tort immunity.
Does that make sense? So the county school, whatever it is, please don't tell me. The county school, I don't want to know. The county school, though, if you have a board that's deciding to do that, and if they are aware that they have potentially lost their shield of tort immunity, they're saying, okay, come for me, and you can sue me, and I'm willing to fight it on my own. Because all 7 of us would have to fight that individually, and the district would have to fight it individually, potentially without insurance. Does that make sense? That's a big scary thing, because school board is a volunteer. Like, we don't make money to do this. I mean, Dr. Geddes is an employee, but does that make sense?
Oh, it makes sense.
Yeah, so that's why. That's part of my thinking, That's part of my thinking. Because I'm a regular person. I'm not like this hugely funded person that can fight big battles. I'm just a regular gal. So that's not that wasn't part of my not part of what I signed up for, to fight big, huge lawsuits on my own.
Well, and to add to that, neither did our spouses. And,
Right.
We could potentially lose our houses and everything, and our spouses didn't sign up for that.
And my wife reminded me that. and I'm not joking. I'm seriously. She did say that, and she goes, "Did you check?" And folks, again, it's a quote. It's a very big risk to take, and we recommend against it. Okay, verbatim from. So I'm going. Okay, she's cut here. My attorney's covered. Right?
The
She just covered.
superintendent's covered, 'cause I told them.
Dr. Geddes is covered because she's told me several times. How about you, Shannon?
No, I put it in writing to all of them.
Yeah, right? We've all seen it.
And sometimes freedom is worth fighting for. I mean, that's why a lot of you are here. Sometimes freedom is absolutely worth fighting for. But you have to, I think that as individuals, we have to decide, is this the hill I'm willing to die on? Is this the fight I'm willing to fight? And I'm looking at you, I'm looking at everyone, I'm not just like you. But we have to decide, is it wise? Is this the wise battle? Is this the wise fight? Or can we win it? And I think that all of us as individuals have had to think that through, because we have very different perspectives on this.
Yeah.
So,
So,
Doctor, I'm just going to make the comment that when you mentioned that another board and other places were considering, that didn't mean that they were going to do it. I would be real surprised if any other board or any other group, actually, when the finals, that they would say, we're going to go against the recommendation. So they may throw it up and have some discussion about it, but I just can't see other boards jeopardizing everything in their personal life at this time. That's
well,
just
we're
my
considering
thought. You will?
Yeah, we're considering it. Okay, I'm gonna do like them. Okay, I'll consider it.
Yeah.
I'm serious. And when I said I have this conversation all the time, if you guys would just hear the conversation that we have, you would you would know how probably really sympathetic we are. Okay, it is the proverbial: are my hands tied? Okay, am I sympathetic? You betcha. That's just me, and I can't speak for 6 other people here. But yes, I'm sympathetic. Okay, do I believe you have a choice? You have a right? Yes. Okay, do I? Yes. But what can I do? I don't know. We'll find out in a second. But yeah, I'm listening to you. I'm listening to every single one of you. Okay, and I am sympathetic.
Dr.
So,
Asher,
yes.
I just want to say, as you were saying, this has not been easy on us. Each one of us have our own reason for what we believe. My husband was one of the first people in Vermilion County to come down with COVID. He spent 39 days in the hospital. They had no idea what to do. He is in the hospital right now because he still has residual effects. So if you think these 7 people have taken this lightly, and every time Dr. Geddes would send us a new email, you don't think we threw our hands up in the air to say, my God. I was sitting in the nursing home with my husband today when I got this email. Had we all discussed what might happen tonight? I know I've talked to 3 just to get some type of idea. Because see, I knew where my heart was, but I couldn't go with my heart. I had to go with what's best for the children of this district. Will we grapple with this? Truly. And like Shannon said, we thought tonight we were going to be peeling back part of the onion to say to you, these are the things that are out there, these are the things that could happen, this is what we're recommending. But again, when you are given something, and all of you, regardless of what you do in life, on your job, at home, with your children, when you're given a mandate, there's not much you can do. But we continue to watch, to see. Just like I said last week, I appreciated, at the last board meeting, every parent that came up here. I wrote it down. I wrote your name down. I wrote what you said. Same thing tonight. So when we get back to that point, we look at what we've sat here and done and heard. Just don't think that we are sitting here thinking, okay, we got this power and we're going to, no. It doesn't work like that. It doesn't work like that. Believe it. Whether it's this discussion or other discussions, we go for what we think will work best for the children of this district. And I had already said, even before 3 o'clock today, there will be people tonight that would not have been happy. There would have been some that would be happy with whatever decision we would have come up with. But we had to do, and we still have to do what's best. And I'm like Shannon. If you don't like what's being said, get on the phone. Not to us. Y'all write us 700 emails. How about writing your legislature some? Let them know how you feel. Because right now our hands are tied. But we appreciate you. But I'm glad Shannon said what she said and gave you the information she gave you. Because at least that gives you an idea of where you go from here to help us.
Could I have a minute, Doc?
Sure.
First of all, Mr. Herron, our legislator is very much in favor of local control. Matter of fact, he just had a posting on his Facebook page about how upset he is regarding, again, another executive order. Again, as Ms. Schrader said, I believe in local control. And, many of you, I've shared with you that I thought that masks should be optional this year. I'll tell you that my opinion changed in the last 3 days. My 92-year-old grandmother or mother-in-law got exposed. We have some health issues in our family right now. So, things change just as the day-to-day with the law, so do the day-to-day with our own family situations. I think there's overreach up by our governor. It won't do you any good to send anything to Representative Marin except to just say, thank you for your help. But it's the governor's office that really has to be dictated. I mean, that's where the push has to go. But, this evening, I'm going to support that our boys and girls and our staff wear masks. I'm going to support the fact that we don't want to have additional issues with our district from the Illinois State Board, whether it's lack of funding or whatever it might be. But personally, I still think that they should be optional. So, anyway, just my comments.
Thank you, Mr. Henderson. And yes, you can still email us. We don't say don't email. We're not saying don't email us. And the good part about it is, actually, if we do see our legislator, I mean, it's good to know what you guys have to say, because we're going to pass it on to them. When we see them, we go, hey, we got a lot of people out there who just don't like what you're doing, and we'll pass it on. But the thought of the evening is, yeah, talk to the legislator or the governor's office. Any other comments or questions? I would entertain a motion, because how we'll do this is, it's we need to put forth a plan. We need to have this plan put out. Okay? As a plan, as we know, if we propose this plan, we do realize that it will be amended regularly, and that it probably will not look the same in 2 weeks. But we need to have something put forth so we can let everybody know at least where we stand tonight. So I would entertain a motion for approval of this plan.
So moved.
Thank you.
Second.
I have a motion and a second. Do I have any other comments or questions?
I just have one comment. Dr. Geddes, you've taken a fair amount of criticism for not communicating, and I believe that this plan and your communication of the last few days was very good. You were very specific, and I thought it was very good, and I just want to commend you for that.
Thank you. All right, seeing that, maybe we have a roll call vote, please. What?
Hold on, I just want to make sure, I apologize for it, but I wanted to make sure that while we have this draft in front of you, there are some changes within the draft, and I acknowledge that there is like one place where we said that we recommend, and I just want to make sure, like on page 4 of 8, Danville District 118 recommends that fully vaccinated, we now require that all people wear it. So I just want to acknowledge that there will be those changes in there based on what happened this afternoon. But because we had the draft on the website, I just didn't want any confusion about what we were approving.
Correct.
Okay.
And so let me say, editorially, this document will be retrofitted to the mandate from the governor, which supersedes all things. Correct?
Yes.
Okay.
So let me amend that. I recommend approval as changed.
Thank you. Okay.
As amended.
Yeah.
All right. Covered us.
Thank you. And the second's okay with
Yes.
that? Thank you. Now, roll call vote, please.
Mrs. Palmer?
Yes.
Mr. Barber?
Yes.
Mr. Beard?
Yes.
Mr. Henderson?
Yes.
Mrs. Schrader?
No.
Pastor Miller?
Yes.
Dr. Edwards?
Yes, motion passes 6-1. Any other business? Seeing none, we are adjourned. Thank you very much. Thank you, everybody. Thank you for showing your interest and support.